Hello, this is Dr. Jaideep Chaudhary with Academics in Nutshell and sore throat, a very common presentation in children. A young child coming with acute onset sore throat with red eyes, rhinorrhea, cough, and sometimes diarrhea. The throat may be mildly congested, but usually there are no pharyngeal exudates and cervical lymphadenopathy is rarely present, is likely a viral origin. Whereas an explosive onset with sore throat, rapid progression but little cough and cold, and pharyngeal congestion with thick exudates, ulcers and vesicles, purulent patchy tonsils, often tender cervical lymph nodes and looking toxic is usually a bacterial etiology. So the viral etiologies generally have a multisystemic presentation vis-a-vis the most common bacterial upper respiratory infection, the group A strepto, usually have a sudden onset comparatively in an older age group, 5 to 15 years children, rarely before 2 years, present with headache, nausea. There are tonsillopharyngeal inflammation with palatal petechiae, strawberry tongue, tender anterior cervical lymphadenopathy, and often a scarlatiform rash. The viruses, the commonest are the rhino, then influenza, parainfluenza, RSV, and others. So, as a whole, viruses cause 60 to 70% of sore throats. Among the bacteria, the group A beta hemolytic strepto is the most frequent, about 30%. Other strepto, diphtheria is an important cause, may also cause acute sore throat. If it's bacterial infection requiring antibiotics, then amoxicillin is the drug of choice, 50 mg per kg per day for total of 10 days. If the child is allergic to penicillin, then we may go for cephalexin, cefadroxil, or azithromycin, clindamycin, and others. But the duration for the cephalosporin should be 10 days and for azithromycin 5 days. One of the commonest differential diagnoses of bacterial sore throat is the infectious mononucleosis, presenting with fever, malaise, sore throat, enlarged tonsils, but a definite cervical lymphadenitis, which is accompanied with a non-tender soft splenomegaly and an urticarial rash. The child looks fatigued, resenting examination, and typical in blood examination, there is high WBC count, few atypical cells, and low platelet. This is infectious mononucleosis, a close DD of bacterial sore throat. So thank you. See you again.